I'm Laura. I'm a certified lymphedema therapist, and this video is going to talk about the treatment end of lymphedema. So once you've been diagnosed, what you're actually going to do to treat your symptoms in the acute phase, which is the initial treatment, and that kind of leads into the management phase once the acute phase is over. So for the acute phase, we do a very specific progression of treatments, and the whole progression of these treatments together is called complete decongestive therapy. So what we're trying to do is decongest the fluid that's collected in the area and the protein that's collected in the area that makes up the lymphedema. So the very first part of the acute phase is skin care, and this seems really basic, but it is very important in terms of talking about lymphedema and making sure that you don't have any complications in the treatment. And skin care consists of very meticulous washing, making sure that you're washing the area very well. If there's any areas that are folding over, any places where the skin is touching other skin, paying special attention to those areas that you don't have an accumulation of moisture, or making sure that there's no breakdown in the skin from that moisture so that you can prevent infections from settling in there and things like that. Some people benefit from using an antifungal soap if you tend to get fungal infections, especially when dealing with the feet, because if you have shoes on, that closed environment is really conducive to fungal infections. Another thing that we suggest is if you have had issues with fungal infections, athlete's foot, any kind of skin conditions, especially around the feet, change your compression garments every day. Make sure that you wash them every day. And if you're wearing shoes, make sure that you get new shoes. I would say at least every 6 months, but if you're having a really bad issue with an infection at that point, get rid of those shoes, wear something else for a little while, and then once it's healed, get a new pair of shoes so that there's no contamination from one pair of shoes to another. Because what can happen is if you're wearing a pair of shoes over and over and you're trying to treat that infection, it's just going to bring that fungus back in there if it's in the shoe. So a lot of people will have problems with that. It's something to consider, definitely, the way that you're taking care of the things that are touching your skin. But find a really good soap that works for you, nothing that's going to be very drying to the skin, because the next part of the skincare regime is making sure that you moisturize. Every time you take a shower or a bath, when you get out, the first thing you're going to do is moisturize that area to make sure that the skin doesn't dry out. One of the things that you'll see is when you have lymphedema, the skin will get very dry, and that dryness in the skin makes you more susceptible to having an infection, because you just don't have that oil, that natural oil to the skin that serves as a protection, and you're more likely to get little cuts or scrapes, things like that can open your skin up for infection. So moisturizing every day, very important. Once you have your skin at a point where it's good, then you can start wrapping. You can't start wrapping if you have an active cellulitis or fungal infection, anything like that. They all have to be taken care of before you start the wrapping process in the acute phase of treatment. But the next part of the treatment, so once the skin is good, we start out your treatment for the day with a manual lymphatic drainage. And this is a sequence that is going to be designed by your therapist, and it's going to be specific to where your edema is. Whether it's in your arm, your leg, or any other place in your trunk, there's a specific sequence that they're going to be able to develop based on where they want the fluid to move to. And it's going to consist of very gentle press and release on your skin. So the way that the lymphatic vessels work, if you go back to the video on the anatomy of the lymphatic system, the capillaries have these little open and close doors where when the skin is stretched, it pulls the anchoring filaments and opens that door. Fluid moves into the lymphatic capillary, and then when you release, that door is shut. The fluid is moved along that capillary. So it's a constant process of stretch the skin, open the door, let fluid go in, and then release gently so that it can close and the fluid moves on. And in that way, it kind of confuses people sometimes because they think lymphatic drainage is like a massage. We usually try to avoid the word massage because you think of really deep tissue work when you're thinking about a massage, that you're working down into the muscles. Lymphatic drainage is done at the surface, on the surface of the skin, and it's just a stretch and release stimulation to the skin to get the lymphatic capillaries gathering more fluid, and most importantly, moving that fluid in the direction that we want it to move, so it doesn't pool at the end of the limb, that we can move it back up to whatever that regional lymph node bed is that will be able to process the fluid out, whatever the healthy lymph node bed is. So sometimes that involves, or actually most of the time that involves moving across a watershed. So if I had radiation done to my armpit, to my axillary area, that damaged those lymph nodes and those vessels, then I wouldn't be able to use these lymph nodes to drain fluid out of this arm. I would have to move the fluid up the arm and then across to the other lymph node bed, across the chest and across the back, so that this area would be able to process it out. Now with the manual lymphatic drainage, there's a couple things that are a little bit unusual about it. The first one is that we work backwards, and this is because of what we call a traffic jam effect. So if you think of a traffic jam, you have all these cars lined up, and we want to move the cars that are in the back of this traffic jam, but they're not going to be able to go anywhere. If we start pushing from the back, nothing's going to happen. We have to move the cars in the front of the traffic jam before anybody's going to go anywhere. The same thing happens if you have fluid in a limb and I want to move the fluid away from your hand. If I start at your hand and start pushing that fluid up, the fluid all the way up here is going to block it. So we have to work in that traffic jam kind of sequence where we move the fluid from here, and then we move the fluid from here and progress all the way down the arm and back up. And then once you go all the way down, then you start moving your way back up. So you've moved all that fluid from the whole area. So when we do the lymphatic drainage, it kind of seems strange because we don't even start working on the area that's actually affected. We work in the area around it so that there's space open for that fluid to move out and away. And then the last thing we do is actually work in the area that is being affected by the swelling. The other component that's really important is for some people, as long as they don't have any contraindications, we do an abdominal sequence to clear out the lymph nodes in the abdomen. And if you look at the picture that shows the structure of the lymphatic system, there's a lot of lymph nodes and trunks and ducts that go through the center of the body. So it's important to make sure that those are cleared out, that they have space, so that when the fluid comes out of the arm or out of the leg, it'll be able to move through that space. So the first thing that we actually do with the lymphatic drainage is we work around the collarbones and around the base of the neck. And that's because of what we talked about in the last video. This is where your lymphatic system actually ends, and it dumps into your circulatory system. Your left and right artery or veins are over here. Left and right venous angles are located right at the base of your neck. So your lymphatic system drains into those. That's the very end of the system. So we have to clear out the end because that's where everything is moving to. We have to make space there. So we start there. We do the treatment on the abdomen if that's indicated for that person. And then we move down the area and then back up the area that needs to be treated. And you always end right back at the center where you started. But it's going to change specifically depending on where your location is that you're having edema and what kind of treatment you've been through. If radiation has damaged a certain area, we have to work around it. If you've had surgery, if you have scars, scarring will inhibit the way that the fluid will move because that scar shows that the lymphatics were cut in that area. So it's very important that you see a certified lymphedema therapist that's going to know the anatomy and know where it's going to be safe to move that fluid. So once the lymphatic drainage has been done, most people think that they're going to see this drastic reduction in limb size, which is not the case, unfortunately. What the lymphatic drainage does is it shows the fluid where we want it to move, and it clears a little bit of space for it to move. But since the lymphatic system doesn't have its own pumping system, we have to use external forces to create more movement and get that fluid going. So that brings us into the next system. Right after you do that manual lymphatic drainage, then you put on a multi-layer compression wrap. There's a lot of different options in this, which is the great thing about doing lymphedema treatment now, is a lot of companies have come up with these very creative solutions so that you don't have to do the intense process of wrapping every day. But the traditional way, and really the most effective way, is to do a multi-layer short stretch compression wrap that's applied every day for a series of days depending on how severe your swelling is or what your limb circumference is and what your end goal is. So the multi-layer compression wrap consists of some padding and usually a stockinette that goes over the skin, and that absorbs moisture and it protects any of the bony prominences that you have because we don't want pressure on those areas. They're just more susceptible to irritation. And after you have all of the padding on, then we start to wrap with what's called a short stretch bandage. It looks just like an ACE bandage, has that same tan kind of coloring, it comes in a roll. The difference is that it's a short stretch bandage, and that just means that it doesn't have as much elasticity as an ACE bandage, An ace bandage has over 100% stretch. If you stretch a piece this wide, it will double in size pretty much, sometimes even more. So it has a lot of elastic fibers in it. The short stretch bandage only has a little bit of give to it, and that's exactly the property that we want, because what that creates is a low resting pressure. So I take that wrap and I go around your arm or around your leg, from the foot up or from the hand up, whatever we need to do. And it starts out with a little bit more pressure at the bottom, and then as you go up, it has a little bit less pressure. So it creates what we call a compression gradient. More pressure down here, a little bit less, a little bit less, a little bit less, so that the fluid is going to respond to that, and the fluid down here is going to know that it needs to move up in that direction. If you have it too tight at any point along that bandage, you can create a tourniquet effect. So you have to be really careful about the pressure that you're putting on when you do the wrapping, and specifically how much stretch you're utilizing in that bandage. But the short stretch bandage is really the key to having this become effective, because it has that low resting pressure. So low resting pressure means that since it's not quite as elastic, it's just going to kind of rest on the skin. That way you get good circulation. You don't want to make it so tight that your circulation is cut off and you can't feel your fingers or can't feel your toes. That's really important. But that low resting pressure gives you good circulation at rest, but then it has a higher working pressure. So what that means is, if I have a wrap on my arm and then I squeeze my hand and I can feel my forearm muscles contract and they become bigger. So when that muscle contracts, it's going to put pressure out toward the bandage. So if this is the bandage, my muscle contracts and it pushes against it. But since this is a short stretch bandage, it doesn't have as much give to it as, say, an ace bandage would. So the muscle contracts and it gets resistance. And every time you do your exercise, you get that resistance, and you can see it's going to create this pumping movement. And since we have more pressure here and a little bit less as it goes up the arm, that pumping movement makes the fluid move back up to the center of the body. That's really the goal of that compression wrap. It takes a bit of practice to be able to get enough pressure, but not too much pressure that you're losing feeling in your fingers. That's just a matter of practicing, unwrapping and rewrapping again, and really getting a feel for how much stretch to use in that. But the most important thing is make sure that you're using the right bandage, and your certified lymphedema therapist is going to make sure that you have the right materials for that. Just be careful, because sometimes people will say, oh, get an ace bandage and wrap it, put pressure on it. The ace bandage is not going to be the right thing to put pressure on that sort of a condition. It's really not good for treating lymphedema. So definitely keep that in mind. Make sure that you're using the right products. And there's a lot of websites out there that are designed specifically for lymphedema treatment that will make sure that you get the right products. Now, with that being said, the multi-layer wrapping takes a little while. It's hard to do. It took me a while to learn how to do it. So when I teach other people how to do it, I try to tell them this is going to take practice, and doing it on yourself is even harder, because I have two hands to use. If I'm trying to wrap my own arm, I'm trying to do that same thing with one arm. Or if I'm trying to wrap my leg, I'm trying to reach down here and be able to keep the pressure and reach everything that I need to. It gets really challenging. So one of the things that I like to offer to people is that there's a lot of alternative garments out there right now. One of the ones that I really like, Solaris, makes some really great products, and I've worked with them quite a few times. And they make these products that are pre-made cushioning, basically. And they'll fit onto your arm depending on where you need it. If it goes all the way down to your hand and all the way up to your shoulder, you can order certain models for that, and your leg. And I'll make another video one day showing exactly how you use those, because they're very interesting. But it has chunks of foam in this material, and the chunks of foam are sewn into these kind of circular spiral patterns that move up your arm. And then you take the bandage and you wrap on top of that once or twice until you have a good compression gradient. And it's much easier than doing all of those layers that you would do if you were just using bandages or just using the padding. It makes it a lot simpler. It's also easier if you did it too tight for you to take it off and then redo it. It doesn't take quite as long. But for most people, if they're wrapping at night before they go to bed, it's a much easier solution than doing all of the different layers. So I like to talk about that. There's another company called Pharaoh that does another product a little bit different than that, that has interlocking Velcro pieces that will create a very nice compression gradient up the arm or up the leg, and they're much easier to put on than a compression wrap. Much less dexterity and skill needed to put those on, which is great because people are usually a little intimidated by the pile of wraps that they have to use. So Faro and Solaris are two really good companies to check out their products if you're not into the whole short stretch bandage, multi-layer compression wrapping yourself. Once you have your wrap on, your arm, your leg, whatever your area of treatment is, the very important part that you need to do after this is a muscle pump exercise. Because of that low working pressure low resting pressure, high working pressure, we need that high working pressure to pump the fluid out of the limb when you have your wrap on. So that means doing a specific sequence of exercises that will contract and relax your muscles. That kind of follows the pattern of the manual lymphatic drainage. So we clear out the center of the body, and then we move down the limb that we're treating, and then we move back up the limb that we're treating, and then retreat the center of the body. So it clears out the lymph nodes and it clears out the lymphatic vessels in that same way. So we follow that traffic jam principle. Move the cars in the front of the traffic jam, and then the cars in the back of the traffic jam have space to move forward. So the best muscle pump exercise, especially if you have lymphedema in your legs, but even if you have it in your arms, is walking. Because you get that cardiovascular activation, you're working on your systemic circulation. Everything is going to start moving a little bit more quickly, and you're getting the strongest muscle pump in your body is in your legs. So you really want to utilize that. That's a really great way to warm up and to work into your exercises. Walk for 5-10 minutes and then do your muscle pump. So say you have arm lymphedema. Your muscle pump exercises would be movements for the trunk, and there's a series of those. I'll do a different video on that to go specifically through that. And then once you do the trunk, then you would start going into the shoulders. You would move the shoulders, and then moving down the arm, you would move the elbow to contract and relax the front and the back muscles. And then you would do the forearm, front and back, contract and relax that. The hand, contract and relax, which is a really important one. You can have a foam ball that you squeeze. Anything that gives you a little bit of resistance there, I'll add into it. And then we go back up the limb. So we would go back up to the forearm, contract and relax there. Go back up to the arm, contract the bicep, contract the tricep. Back and forth a few times that way. Shoulders, get some movement around there. You can shrug, you can circle. And then back to the trunk, so we get the center of the body, and we would do trunk movement. So you can see how it goes center, down the limb, and back up. The medical terminology for that is proximal. We do the center of the body. Work your way out distally, which means the end of the body, and then back into proximal. So that brings us through all 4 of the parts of the complete decongestive therapy. This is all about getting the fluid mobile. Now, the important part that makes this different is the manual lymphatic drainage is going to move protein too. Since we were talking about that open and close with that flap in the lymphatic capillaries, we stretch the skin, it opens up, and then we release the skin and it closes. That allows the fluid to move in, but it also, most importantly, allows the protein to move in. So protein is a little bit too large for the venous system to process out. So the lymphatic system has to open that door, let the protein go in, close, and then it moves it along. Since we talked about in the last video that protein is the aggravating factor in lymphedema, it aggravates the skin, it causes fibrosis. There's a lot of complicating factors in lymphedema that come from that protein component, and it's what makes lymphedema unique is that protein. So if we really want to treat lymphedema, we have to do a treatment that's going to move the protein, not just the water. So for some people who are going through lymphedema treatment, a lot of times people will automatically, or doctors, or whoever, will automatically prescribe a diuretic or some kind of a water pill to get fluid out, which at first thought seems good. You want to get rid of the fluid. The problem is if you move the fluid but don't remove the protein, the aggravation is still there. The inflammation is still there from that high protein concentration in that space. So you'll still start to get problems down the road of cellulitis and infections, skin changes, keratosis, all those kind of things that we're trying to avoid in the later stages of lymphedema treatment. And what will happen also is if you still have the protein in those spaces, no matter how many diuretics you take and how much fluid you take out of the body, that protein has a very strong attraction to water. It will still pull water to that space. So eventually the swelling will come back, even if the diuretic initially worked. In the long term, it's not a good treatment. Now, with that being said, there are some people who are taking a diuretic for another condition. Maybe their heart is compromised, or their kidneys, or something else where they need to keep their fluid content low, and they need to make sure that their body is getting rid of enough fluid. So if you're taking a diuretic for that, it's good. You need to keep taking it. Don't stop taking it. But if you're on some kind of a water pill specifically because you have lymphedema, have a conversation with your doctor about that and see if that's why you're taking it, because it's really not a good treatment for lymphedema. It can cause more problems in the end. So something to think about. Some of the other things that I like to touch on, one of the things that's really commonly prescribed that I see almost all the time is the pneumatic pump. And people think that this is an easy way to treat their lymphedema, to put a manual pump on their leg. It's like a big sleeve for your arm, for your leg, and then it attaches to a machine that pumps air in and out of it and creates like a massaging effect. But the problem with that is it's a little bit more aggressive than what we would want for the lymphatic system. Like we were saying, the stretch and pull that we're doing on the skin, that very gentle stretch and release to open those flaps in the lymphatic system, has to be very gentle, or else the lymphatic system gets overwhelmed and it'll kind of become this uncoordinated effort to move the fluid along. If you put something that's very strong like that on a lymphatic problem, it can make it worse in the long term. The other problem is that it will move the fluid better than it will move the protein. So just like we were saying with the diuretic, if you're getting the fluid out but the protein is still there, you haven't solved the underlying problem. So that's really important. The other problem, and this is a big one, is if you're using a pneumatic pump for a long period of time, it can cause more damage to the lymphatic system because it is so aggressive, and after a while you usually need to turn the pressure higher for it to be as effective. What can happen is, say it's pushing fluid up to the top of your thigh, or say it's pushing fluid up to the top of your arm, it can overwhelm the lymph nodes there because it's so aggressive. For some people, if they use it for a long period of time on their legs, they can get what's called genital lymphedema of the genital area, and that's something that is very challenging to treat, and it's a complication that you don't want to add to already having lymphedema in your legs. So you have to really think about if the pneumatic pump is going to be a good treatment for you. In the school that I was trained at, we try to discourage people from using it because of the complications that can arise. In certain situations, it might be a good treatment. Most specifically, people who maybe have a mixed venous edema and a little bit of lymphedema starting, maybe they want to use the pump. But again, that's something I would recommend you look into more, see what the side effects can be. So, we talked about the manual lymphatic drainage, the short stretch bandages, the muscle pump sequence. This is really the most effective way to treat your lymphedema. So next we're going to talk about the long-term management of lymphedema. Thank you so much for joining